There are a number of myths and misconceptions as it relates to Parkinson's disease. So, for example, one of the most common is that Parkinson's disease is a death sentence. Because people have this myth or misconception in their mind, when they're diagnosed with Parkinson's, they often go into a deep state of isolation or depression because they're worried about what the future holds. I try with each new diagnosis to inform the person that this is not a death sentence, that there are many things you can do to live and thrive with Parkinson's. So I think myths like this one are so harmful because it creates more stigma, more apprehension, more fear than is necessary, and serves as a barrier to actually getting the care and treatment one deserves to help them live a good quality of life. There's a myth that Parkinson's disease only affects older white men because the initial description by James Parkinson back in the 1800s included an illustration of an older white gentleman with a stooped posture having Parkinson's disease. Michael J. Fox has done a tremendous amount to raise awareness about Parkinson's disease, but there are certainly others like Colin Powell, Jesse Jackson, Muhammad Ali. But I think there's a lack of these figures and speaking publicly to make the community aware that Parkinson's can affect all ethnicities and races. Often people suspect that Parkinson's only impacts the older adults in our communities, when in fact young onset Parkinson's disease is a less common but important condition to be aware of. Parkinson's disease, of course, the hallmarks are motor symptoms. So research has shown us that non-motor or invisible symptoms of Parkinson's are just as prevalent, if not more impactful on one's quality of life than motor symptoms. So this includes symptoms like fatigue, constipation, changes in cognition or thinking, mood changes. These invisible or non-motor symptoms are certainly common, but frequently unrecognized and not discussed in the doctor's office. So Parkinson's disease is a progressive condition and it's degenerative in nature. So I think because we don't have a cure that reverses the course of the disease, there's often this perception that there's nothing that can be done, when in fact, medications can alleviate the symptoms of Parkinson's, both the physical and invisible symptoms, and there are changes one can make to one's lifestyle, including adjustments in nutrition, strategies to help you cope with stress, as well as exercise. The condition is progressive. So levodopa, which is the principal medication we use to treat Parkinson's disease, often we have to adjust the medication, the timing, or the dose to help continue to manage the symptoms of Parkinson's. It's not that it stops working, but that it does need to be adjusted over time. When I speak to my patients who've been especially newly diagnosed with Parkinson's, I do ask them if there's any specific perceptions or conceptualizations they have of Parkinson's disease, because if they do have a misconception or a myth in their mind, I want to do my best to dispel it. But I do think that if there's something that you have in your mind that you're worried about, that concerns you or your family members, to try to express that to your doctor so that they can help you understand that better.